You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with the new small diameter or mini dental implants. With us, we have an expert on the topic. We've had him on the show before. He says no more dentures, that nobody should be wearing a traditional denture. Dr. Matt Lasorsa, welcome to the program.
Thank you, Randy. Good to be back.
Now, I know you brought a lot of photos, so we'll get to as many of those as possible. And now, for people that don't know your practice, I guess you have four
locations throughout Central Florida.
All right. And what's your role there?
My role is I'm the implant dentist.
Okay.
I do all kinds of implants, and I mostly focus on the surgical part of it, the extractions, the implants, and the bone grafting. And I have several associates that are trained to make the beautiful smile once the implants are healed.
Okay, good. Now, you were on the show before, and do people see you and they come in and they're still skeptical, you say?
Yes, every day.
Like they say, can you really do this?
Every day.
What do they say?
They say, you know, I saw you on TV, and am I a candidate? Their first question is always, am I a candidate? Can you do this for me? And there, you know, it's very rare that there's somebody that's not a candidate. We use 3D imaging and panoramic x-rays, and we get a full view of their bones, their teeth, their nerves, their facial structures, and I can tell them that day what I can do for them.
Okay, good. And they're still skeptical, even after you tell them?
Sometimes. We go through the plan, we go through the options, and once they understand what we can do and we show them the models and go through the financing, then we usually move forward.
Okay, so we had you on the program before. What was it, a couple years ago? And so who's the typical patient that's coming in for the mini implants?
My typical patient is generally an older patient, may be retired, may not be, but it's somebody that has not been going to the dentist, hasn't seen the dentist in years, and they saw my advertisement or they saw me on TV, and they want to come in and see if I can get them to have teeth that they can eat with, they can chew with, that they're comfortable smiling and being themselves again.
So is this true, by the way, that you can literally walk in on the day of the procedure, walk in without teeth and walk out with teeth, a full arch of teeth that don't come in and out?
It's true.
Really?
Yeah.
Rarely that happens?
Well, if we're gonna go to that extent where the teeth aren't going to come out, there's some planning phases that have to be done before then. But absolutely, we can put the implants in one day, and we can have either the denture relined one day or a temporary bridge made that day, and they can walk out with a full arch of teeth.
So they're never without teeth?
I will not let anybody walk out without teeth. That's just not right.
Okay. Now, these mini implants, they're different than regular implants. You say they're half the cost, less downtime. Do they work?
They do.
But I have to say, I mean, I have dentists that come on the show, and they say, Randy, the mini implants, they're not there yet. They don't work. What's your response to that?
I mean, that's an old school of thought. I mean, we're beyond that now. Mini implants have been around for over 20 years. There's been several studies. They're approved by the FDA for long-term use. When used appropriately, they work as well, if not better, than traditional size implants. Where they're appropriate, that is my implant of choice.
All right, and they are less expensive.
They are less expensive. They're less invasive, quicker healing.
Now, you say you give people their teeth back, and it changes their life.
It does. It does. There's somebody that's out there that's been suffering. They don't want to smile. They don't want to go out in public. They don't want to get a job because they're afraid of their appearance. They're afraid of what people will think of them. And if we give them the teeth and the smile that they want, all of a sudden they're much more confident. They're more comfortable with their friends, with their family, at a restaurant, at their job, and that changes their lives. Okay, so here's my typical patient that hasn't been to the dentist in years and is looking for help. Now, this patient has a lot of cavities, a lot of periodontal disease. He needed multiple extractions, did not want to go to dentures, so it was not an option for him. A lot of people come in and they think they're going to walk out without teeth. So we always make something that they can walk out with so they can eat and chew that day. It may not be their permanent denture, but they'll have something to walk out with and smile with that day. So he came in and in one day we did his extractions, his implants, and gave him his dentures in the same day. So if you look at this picture, he has to get used to smiling because he wasn't used to smiling before, and this is going to be a game changer for him. Okay, so let me tell you about this next patient. He walked in with failing teeth and an upper denture that he was not happy with. So what we did for him is we locked down a full arch of teeth upper and lower.
Supported by mini implants?
Supported by mini implants. Okay, so you can see from his facial expression how much happier he is in the second photo. The lower bridge was loose on his natural teeth, and his upper denture wouldn't stay in. So we locked in a full arch of teeth on the upper, and a full arch of teeth on the lower, and you can see by his reaction, he's much happier now than when we first met him. Having teeth that locked in, he can now eat and chew and do whatever he wants.
Like what? Like what could he eat?
I mean, he can eat popcorn if he wants. He can eat corn on the cob. He can eat steak. He can eat peanut brittle.
Is that right?
That's right.
So once you put the implants in, put the teeth on top, how soon can they eat? I mean, how soon after the procedure?
Well, right away, the same day. Now, I want the anesthetic to wear off. They're numb during the procedure, but once that wears off, I don't want people to think they can't eat after the procedure. They can eat right away.
Okay. And what about downtime as far as pain?
Just one day. It's going to be sore the first day because there's trauma involved with placing a number of dental implants. But I usually recommend that they can go back to work the next day. They don't have to take a week off of work or anything. Usually one night of pain medicine is generally what we see, and they're back to normal the next day.
Is that right? And with the mini implants, I mean, in your office, you're just numbing them up, and that's all it takes?
Yeah.
I mean, you don't need some heavy sedation for this?
No, not at all. I like people to be conscious and aware of what's going on. So if they're feeling anything, I want to know. So I want them to be conscious and talking to me. So I'd rather use local anesthetic than anything complicated. Once he saw the final photo, he was very happy. I mean, he's just a different person now, that he doesn't have to worry about his teeth being loose. He doesn't have to worry about his dentures coming out. Now he can eat and chew comfortably and smile confidently, and he even stands a little taller now.
Is that right?
Yeah.
It's self-confidence. Are there a lot of people where you are with false teeth? I mean, now that you've done this program, right, airing on TV a couple years, I mean, are there really that many people where you are?
I mean, they're coming in every day.
Like an upper lower denture?
They're coming in every day.
Really?
Every day.
Well, then if it's so good, right, if there's so many people out there with wearing dentures, why aren't they all doing it? Why aren't they all coming in for consults?
Well, number one, a lot of people don't understand that just about everybody is a candidate. The first question I always get asked when they do come in is, am I a candidate? Can you make this happen for me? The other thing is cost. People are always afraid that they've been told several years ago this is going to cost thousands of dollars. They're going to have to remortgage their house, and the cost is always a question. People don't like the unexpected. They don't understand the procedure, so they're afraid to come in because they're afraid of the unknown. So another reason why people the denture wearers don't come in is because it's been so long since they've been to the dentist. They don't really understand their options.
Okay.
They don't remember what it was like to have their own teeth, to be able to eat what they want, to not worry about adhesives, to not be self-conscious about it. And another reason they don't want to come in is because they've spent a lifetime in the dental office. Okay, they've spent a lot of money, a lot of things failed, and they remember that. So they were almost relieved when it was all over and they didn't have to go back anymore.
With all their teeth taken out.
Exactly.
Is that right?
Exactly.
Is that what they tell you?
A lot of times, they tell me they've spent a lot of money over the years, been to a lot of dental visits, and look, now they're in a denture anyway, so they feel like it was all for loss. So that they're traumatized by that because they've been through a lifetime of fixing their teeth, a lot of money, a lot of trauma, and a lot of loss.
So the last thing they want to do is come in to see you.
Sometimes, yeah.
Is that right? Do you still hear it, by the way?
I do.
Like, no offense, doctor, but I hate the dentist?
Well, I hear a lot of I hate the dentist, and I hear a lot of I've tried this, I've had this, and nothing's worked on me. So is this going to work for me? I hear that question a lot.
And most people you say are candidates?
Almost everybody.
Like you don't have to turn, I mean, you can always work with them one way or another?
It's very rare that I have to turn somebody away, and it usually has to do with something in their medical history. Almost everybody is a candidate for mini dental implants if they want them.
How old can you be to get this?
I've had several people in their 90s, and
Really?
I've even had a few that were over 100 that had this
Why would a
procedure done.
100-year-old want to do this?
Well, a 100-year-old, this particular patient that was 100 years old, he came in, he could not wear a lower denture, could not wear a partial. He has not worn a lower denture for 30 years. So for 3 decades, he's been suffering with no lower teeth, and nobody would touch him because of his health history. So I thought he deserved a try. So I was able to place mini implants on his lower arch and snap on a lower denture for him. So for the first time in over 30 years, he's able to eat and chew just like his 98-year-old wife who has all her teeth, okay?
Right.
Yeah.
So now it's got to make you a little nervous working on a 100-year-old.
A little bit.
Is that right?
Well, a little bit, just because he had a lot of medical concerns, but we took everything slow, and he did very well.
So these mini implants even work on somebody that age?
Absolutely.
Is that right?
Yeah, even a single tooth implant was, I placed a single tooth implant on somebody that was 101. It was a patient of mine, it was his mom. She snapped off an upper incisor, and he didn't want her to go without the tooth. So we placed a single tooth implant, a mini implant, and restored it with a crown. And she just celebrated her 101st birthday a few weeks ago.
So then 80, for people that think they're too old if they're 80, which is young today, that's young, I guess, in your office.
If they plan on living to be over 100, wouldn't you want to eat and chew and smile for the next 20 years?
Is that right? So it doesn't matter how old you are, these mini implants,
They work.
they stay under the bone.
They work.
Like the bone grabs onto them?
Absolutely. The bone fuses to them just like any other implant. They're made of the same metal. They're made of titanium alloy. They fuse to the bone as well as anything else.
Now, another thing you're doing, I guess, is using the patient's own stem cells for faster healing. Is that right?
Well, I wouldn't say it's stem cells. There's stem cells in it, but I wouldn't call it a stem cell treatment. What we use is PRF. It's platelet-rich fibrin. It's your own platelets, your own blood, concentrated with your growth factors to speed up the healing, to get about a 10-fold increase on your growth factors to speed up the healing.
And they just heal faster, low downtime, less soreness, all those things?
Less pain, quicker healing, faster bone growth, faster gum growth, faster healing. So let me go back to that photo I showed you.
All right.
Okay. Now just look at how it's changed his appearance. Look at how much more confident he looks in the second photo. Did he look confident in the first photo?
No.
He looked like he was struggling, right? But look at him in the second photo. That's a genuine smile right there.
Yeah, it looks like he does look younger.
Absolutely.
In the after. You know, I joked with you in the green room, like it's just teeth. Are teeth really that important?
Well, there's something you're going to use all day, every day. So absolutely, they're important. Next photo. So she came in and she had a lot of loose teeth and she was heading for dentures. That would have been her only option without implants. Okay. Even the fixed denture idea wasn't appealing to her. So what we did for her is we put a full arch of mini dental implants on her upper and lower, and we gave her fixed porcelain teeth, upper and lower, that don't have to come in or out. And we gave her a new smile. So if you look at the before and after, in the second photo, she's not even used to smiling with her new teeth yet. That's when when we first delivered them. But over time, she was so happy that she wanted a picture with me.
Is that right? Okay.
So look at how natural her smile looks now.
It doesn't look like a denture. They don't look like fake teeth.
No,
right?
those are fixed teeth, and that's another genuine smile. She's generally so excited about her new teeth.
So with those teeth, you could even use the front teeth to bite like a raw carrot, or you have to be careful with the front teeth.
No, when they're implant supported like that, you don't have to be careful eating a carrot or an apple or anything like that. She can eat and chew whatever she wants.
Are they scared, by the way, to eat? Maybe after it's done?
Maybe the first few times.
Do they ever call you and say, are you sure I could do this?
Yeah, we get those questions, and we go over a lot of post-op instructions, a lot of follow-up visits to make sure they're comfortable and they're happy. And sometimes we have to adjust the bite a little bit, but we tell them to use them as natural teeth. Go try them out.
Now, is this the future of dentistry? Like dentures as we know them today, whether it's 10 years or 50 years, do you think in the future that all people that have no teeth, they'll be anchored to something like dental implants?
I hope so, because it's such a good option. It's so different than what people had to struggle with. That was just what they were left with. But now we can reverse some of that with dental implants to secure them down and give them back the function and the smile that they want.
And you like the mini implants? They're less expensive, less downtime.
I think they're a good option for just about everybody.
Okay, great. So what else do we have? What else are we looking at?
So this patient came in with no teeth and no dentures. She had nothing. So this is how she went around for the last 3 years, with no teeth and no dentures.
Wow.
So she had enough bone, and she decided she wanted a fixed arch of teeth, both upper and lower.
Good. So what did you do for her?
We placed a full arch of implants on her upper and her lower, and we made a fixed set of teeth on her upper and lower.
Let's take a look.
So look at the difference between the before and after on this woman. Just look at her smile in the second photo. That's a very natural smile. She looks at least 10 years younger.
Yeah. It's changed her appearance.
It's changed her life. She was going around without any teeth at all. She was embarrassed to talk to people, embarrassed to look at people. And now she's showing them off.
So this has got to be a big self-confidence booster.
Absolutely.
So they're probably on Facebook doing some selfies.
I would hope so. I would be proud of that. After it was all said and done, she could not stop complimenting on how nice they looked. And as we saw her for follow-up visits, how many compliments she got from her friends and family.
On the teeth. I mean, they look natural. So you're in on the design? You say you have this kind of team approach?
Yes. We have a team approach where I do most of the surgical part. I'll do the extractions and the implants and the bone grafting, the soft tissue, the gum grafting. And I have several associates that are well-trained to make that smile, to make those beautiful teeth that people want.
Now, how it's normally done with dental implants, mini implants, is two people are involved. You go to one person that does the surgery, and correct me if I'm wrong, another person that puts the teeth on top, and another place maybe that even does the imaging. You do it all right there.
Yes, we have the imaging, we do the surgery, and we make the teeth. So we do it all under one office. So you don't have to go to 3 different places, get 3 different estimates or 3 different opinions. We'll do it all and work with you to get it all done for you.
Okay, good. Now we should mention that Medicare, Medicaid does not cover this procedure here in the U.S.
No, Medicare and Medicaid does not cover the dental implant procedure. Most dental insurance doesn't cover dental implant procedures, but we will work with you to maximize your insurance even within 2 different calendar years, so we can get the most benefit out of your insurance, and we'll offer financing. We can do things in phases.
So now there's no more excuses, right?
No more excuses.
Doesn't hurt very much. You could be 100 years old, you say, to do this.
Almost everyone's a candidate, low cost, low risk. We'll work with financing options. We'll work with your treatment options. There's no risk to come in and have a consult. So here's my next case.
All right.
Okay, so this patient was very self-conscious about her appearance. As a matter of fact, she really wouldn't go out of the house and didn't want to get a job because she was so self-conscious about it.
Is that her smile?
That is her attempting to smile.
Okay.
That's the best she could do. She had a lot of cavities and was not interested.
Now, teeth like this have to be somewhat unusual. Is that right, to be like this?
I wouldn't say it's unusual because those people are not coming into the dentist. You don't see those people because they don't smile. They don't want to show you. They would rather stay home.
So there's a lot of this going on, but they just hide it.
Yes.
Is that what you're saying?
Yes.
Okay.
So for her, we gave her fixed teeth on the upper. They don't come out, just like your teeth and my teeth. They don't come out. And she has a much more natural smile, and she got so much confidence over her new smile that she actually went out and got a full-time job. So look at the dramatic after photo of this patient. Look at the confidence she has in that second photo.
It does not even look like the same person.
It doesn't look like the same person.
I think everybody would agree with that.
Okay, so now she's much more confident. She's out of pain. She's out, she got a job. She's smiling night and day.
And they look natural. I mean, those look, people need to know. I'm not siding with you on this interview. I'm just asking the questions, but this is really
they look beautiful.
A dramatic result.
Are you kidding me?
I mean, she's got to be thrilled, obviously.
I'm thrilled.
On the consult, when you see this, right, and you must hear a little bit of their hard luck story, do you get excited where you're thinking, boy, this is going to be good?
Well, yeah, I knew what we could do for her. I knew we could change her whole smile and her whole lifestyle. When I saw what she's been suffering through, a lot of people come to me as a last resort. I hope you can help, because they've been to the dentist, they've had traditional fillings and crowns and the denture option, and they come to me because they want to see if there's something more I can do than traditional dentistry. So now, every time she comes in, she still gives myself and all my office staff a big hug. She's so happy. She loves her new smile. She loves her new teeth. So aside from the pretty smile, the other side of it, she was in pain before. She was constantly in pain. She's constantly at the dentist. She couldn't eat what she wanted. She couldn't smile. She couldn't chew. She was constantly thinking about pain. And now she's out of pain, and she's happy, and she's confident. Okay, look at the before. The areas where she was missing teeth, the dark black holes on the sides of her lips.
Yeah.
Okay, and look at the after, where we filled it in, where we lined up her lip line, lined up her smile line, the length of the teeth, the shape of the teeth. I have to give it to my wife for lining up the cosmetics on this case.
All right.
So this next patient had what we call a worn dentition. Teeth were worn out from years of grinding.
Wow.
So for him, the combination of dental implants and cosmetic dentistry, we opened up his bite.
So mini implants for this guy too?
Mini implants for this guy too. We opened up his bite to where it was when he was 18 or 19 years old. We got him back into his youthful form and function. So he now has a full arch of teeth, upper and lower, that he can smile with confidence and eat whatever he wants.
You say people with bad teeth are discriminated against. What do you mean by that?
Well, people with bad teeth are discriminated against because of their appearance. People associate having bad teeth with being poor. Now, some of these people have taken very good care of their teeth their entire life, but they're more susceptible to gum disease. They're more susceptible to cavities. They grind their teeth, so they do a lot of damage to them. So let's say they were twin brothers. Which one are you going to hire? The one that is smiling or the one that isn't? It's the same person.
Good point.
But there's one with a lot more confidence and a lot more life than the other.
But what about if you have bad gums, like periodontal disease?
Mm-hmm.
Are your gums good enough to qualify for these mini implants?
Well, those are the people that come in every day, the people that do have bad gums. In that case, we remove the teeth, we remove the periodontal disease. The periodontal disease lives on the teeth.
Okay.
So once that's removed, the infection is gone, and we use the PRF, the platelets, to restore the gums and restore the bone and place our dental implants there. This is my Picasso. This patient came in, and I want to get this out to people. This patient avoided going to the dentist for years because she was so afraid that if she went to the dentist, they would remove all her teeth and she would walk out with no teeth. So that was her primary reason.
What's going on there? I mean, not to sidetrack here, but let me take a look at that close-up.
This is severe periodontal disease. This is as bad as it gets. A lot of loose teeth, not able to save anything. So she was afraid of leaving the dental office without any teeth, which made her scared to death to come into the dental office for years.
So when she talks to you, this is what she's asking.
Yeah, so I assured her that she would not leave the office without teeth. We wouldn't do any surgery unless we had some teeth made for her ahead of time so she could walk out with confidence.
Let's take a look. Oh my goodness.
So that is her after photo. And now she's just sparkling with confidence. She comes in with tears of joy because of the difference in her appearance when we started and where we are now. And this wasn't a whole lot of healing. Believe it or not, once we removed all those teeth and all that gum disease was removed, it was very rapid healing till we could go to the final phase.
So this full arch of teeth that you're showing here, I mean, this is supported by mini implants.
Yes.
Do they come in and out? These teeth?
Those do. Those are snapped
on.
on.
So it's a snapped in, locked in.
Those are snapped on with mini implants, upper and lower. Even with these snap-on teeth, she can eat whatever she wants. Again, she can eat apples, pears, corn on the cob, popcorn, steak, whatever she chooses to eat. She doesn't have to be careful what she eats anymore. She doesn't have to be careful when she smiles anymore. Look at her. She's smiling.
That looks good.
And notice she was wearing sunglasses on the before photo. She was a little shy. I had to coax her into getting photos. She was a little shy of the before picture. But I wanted to show her where we started and where we are now. And look at the after photo. I don't think she's shy anymore.
Now, you called this at the beginning your Picasso.
Yes, because I knew I could make such a big difference by the end result. To me, this is a work of art, to be able to bring somebody from this level to this level, from start to finish.
It's very
Just
nice.
a world of difference in function and confidence. And when people go from this stage to this stage, their friends, their family, everybody comments on it. I mean, her husband comes in with her, and he can't believe it. He can't believe the change in her, not just in her teeth, but in her whole personality.
So it's just about, their self-confidence.
It's about function and self-confidence.
So people really, there's a lot of people out there that are insecure about their teeth.
Absolutely. I mean, that's why I've been so busy. We see them every day.
And they all think, as you say, like they're the only ones.
Either they're the only ones, or they're not a candidate, or it's going to be too much, or it won't work for them. But I'd like to get the word out there that you're not the only one, and that's why I'm showing so many cases, because we can change your life. We can make things better for you. This is a special case. This patient had 2 bouts of oral cancer, so he's had a lot of surgery, a lot of skin grafting, and a lot of radiation in his jaws. That's usually a contraindication for dental implants, meaning that usually can't be done after someone's had radiation in their jaws. I got special permission from his oncologist and from other oral surgeons in the country that specialize in patients that have had this type of treatment. And I was able to put dental implants on his upper and lower arch without making incisions, so we didn't ruin any of the blood supply. And every one of those implants were successful. And for the first time in 5 years, he was able to wear an upper and lower snap-on denture. So this guy This guy cannot stop smiling every time he comes into the office. This patient went from not being able to wear teeth at all because of his medical history, because he was a very high-risk patient to work on, to He's got a full set of implants and teeth that are locked down, and he can eat and walk around and be confident. Look at how much he is like that from ear to ear, from the time he walks into the office to the time he leaves. He is an inspiration to everybody.
Now, when they look at their mirror for the first time, right, do they get choked up sometimes?
It's shocking, yes. Yes, because these people are not used to looking in the mirror. They're used to avoiding the mirror. And they're actually kind of scared the first time we showed them and they look in the mirror because they don't know what to expect.
So we're short on time. A couple more photos, quickly.
Can I show you a couple more?
Sure.
Absolutely. Okay. So this patient is fairly young and just had a lot of dental problems and was at her wit's end. She was very upset. She wasn't confident. She didn't like the way she looked, and she came looking for help. So in one day, we were able to remove all the teeth, place dental implants, and give her a full arch of teeth so she could walk out with a lot of confidence.
Pretty.
Beautiful. I mean, look at this is not a happy person in the first photo, but look at her in the second photo. Just look at the aesthetic part. Look at the difference between the teeth she had naturally and the teeth we created for her. Look at the lip line, look at the smile, look at how those teeth just fit her face and light up her day. So one more. This patient.
All right.
This patient is a very nice man, heavy smoker, had a lot of periodontal disease, had a lot of failing teeth, and didn't want to go to dentures. He had been avoiding it for years and did not want to go to dentures. So we used mini implants to get a fixed arch of teeth, upper and lower, that do not come out, and here he is today.
It's amazing.
Just look at what it's done to his appearance. I mean, all we changed was his teeth. His outside appearance hasn't changed. We changed his teeth, and look at the difference in it. Look at how much happier he is that he doesn't have to worry about loose teeth or pain or periodontal disease anymore.
So no more dentures.
No more dentures.
You're going to
please.
wipe them out where you are?
I hope so. I'm on a mission for it. I haven't mentioned this, but usually when we're all done, the guys give me a high five, the women give me a hug, and sometimes a combination of both. And that's what it's all about. If I can change somebody's life and I can make them happier, out of pain, and a lot more confident, that's what it's all about to me.
Now, are these people that say, I should have done this a long time ago?
Every day.
Really?
Every day they say, I wish I had done this 5 years prior.
So we're out of time. If people want to know more, they can go to their website. They can call your office. I guess you have 4 different offices.
4 different locations, yes.
And you work in all 4 of them?
I do.
Is that right? So and people could drive. They drive 2 and 3 hours.
We try to guide you to the closest one, so it's more accommodating for you. But not all of these cases are up on our website, but we have a lot of video testimonials of some other patients that you can see a similar result.
Okay, good. Thanks again.
Thank you, Randy.
And thanks for coming back.
And thank you for having me.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.